Hello my dear friends, welcome to my channel. This is Vinci Joshi. Today we can discuss some important questions related to neurology. First one, a client with leaking intracranial aneurysm has been placed on subarachnoid precautions. A visiting family member wants to take the client to the unit solarium for just a few minutes. The nurse would use which of the following concepts when trying to explain why the client must remain in the room? Options: client with aneurysm need isolation to cope up with photosensitivity. Second, reduced environmental stimuli are needed to prevent aneurysm rupture. Third one, a quiet environment promotes more rapid healing of the aneurysm. Fourth one, a client has altered thought process and need reduced stimulation. What is our question? The patient with intracranial aneurysm and placed on subarachnoid precautions. So, the patient family wants to take the client to somewhere else, but the nurse take which precaution? The next explain why it is not allowed. So, the patient with intracranial aneurysm, there is a chance to bleed. So, we have to reduce environmental stimuli, stress and strain to the patient. That's why our answer is second one. What is the rationale? The subarachnoid precautions are intended to minimize environmental stimuli, which could increase intracranial pressure and trigger bleeding or rupture of the aneurysm. Okay. The next question. The client with suspected Guillain-Barré syndrome has lumbar puncture performed. The cerebrospinal fluid CSF protein is 750 mg per dl. The nurse analyzes these results as: first option, normal. Second, lower than normal, ruling out Guillain-Barré syndrome. Third one, higher than normal, supporting the diagnosis of GB syndrome. Fourth option, not significant and unrelated to GB syndrome. What is our question? What is the diagnostic test for GB syndrome? A lumbar puncture, the CSF fluid has taken. So, while doing the procedure, the CSF protein is 750 mg per dl. What is the normal range of protein? The normal CSF protein is 15 to 45 mg per dl. So, our answer is 750 mg per dl. So, what is our answer? 7 to 10 days following the onset of symptoms of GB syndrome, the spinal fluid protein level become extremely high. Normal CSF protein is 15 to 45 mg. A value of 750 mg per dl is higher than the normal, supporting the diagnosis of GB syndrome. So, our answer is C, higher than normal, supporting the diagnosis of GB syndrome. Okay. Then move to next question. The nurse is admitting a client diagnosed with brain attack and a history of cardiac disease to the hospital. The nurse would perform a neurological assessment and obtain additional data regarding the client's what? The patient has stroke. He has a history of cardiac problem also. First option, peripheral pulse rate. Second, apical heart rate and rhythm. Third one, bowel sound. Fourth one, body temperature. Our answer is an irregular apical heart rate and rhythm may be present in a client with a history of cardiac disease. So, we have to check B, apical heart rate and rhythm, to assess the cardiac conditions with a history of cardiac disease and cause some type of brain attack. The peripheral pulse rate would not be provide significant information related to cardiac disease or stroke. So, our answer is B, apical heart rate and rhythm has to check by the nurse to assess the cardiac problem. Next one, a nurse is teaching a client hospitalized with a seizure disorder and the client's spouse about safety precautions after discharge. The nurse determined the client need more information if the client state and intended to. What is our question? The patient has a seizure disorder. On the time of discharge, the client's spouse has some questions related to safety precautions. Nurse explain everything about one. Some points the client's spouse did not understand. So the nurse has to give more information. These kinds of questions are called negative questions because the patient party or somebody did not understand. So we have to clarify their doubt or we have to give more explanation. So our answer should be something like negative things. Okay, we can go to the options. First one, take all prescribed medications on time. Second one, have a spouse nearby when showering. Drink alcohol in small amount and only in weekend. Fourth one, refrain from smoking alone. First option, take all prescribed medications on time. This is a good thing to do. Second one, also have the spouse nearby when showering. This also the good thing. So our answer should be, I said, it should be something negative things. Fourth one, refrain from smoking. That is also good thing. Our answer is third one, drink alcohol in small amount and only in weekends. It's not good thing. The client should avoid the intake of alcohol. Alcohol could interact with the client's seizure medication. So when somebody is taking the medications for seizure, do not consume a small amount, even a small amount of alcohol also. It is not good. It may precipitate seizure activity. So patient has to avoid drinking alcohol. So our answer is C. Next one, a nurse is preparing a plan of care for a client with brain attack, stroke, who has global aphasia. The nurse incorporates communication strategies into the plan of care because the client's speech will be, first one, intact, B, associated with poor comprehension, C, characterized by literal paraphrases, D, rambling. Our patient has brain attack. So patient has brain attack and got global aphasia. So what is our answer? Our answer is B, associated with a poor comprehension. What is the global aphasia? Is a condition in which the affected person has few language skills and results of extensive damage to the left hemisphere. The patient with the left-sided brain stroke, the language problem may affect. The speech is non-fluent and is associated with the poor comprehension and limited ability to name, object or repeated words. The client with conduction aphasia has difficulty repeating words spoken by another and speech is characterized by literal paraphrases with indirect comprehension. The client with Wernicke's aphasia may exhibit a rambling type of speech. Okay, next question. The nurse employed in an outpatient diagnostic laboratory department assesses a client who arrives to have an electroencephalogram. The nurse determined that the diagnostic test may needed to be rescheduled if which of the condition is noted. The patient came to the department for EEG. So the before doing the diagnostic test, the technician may ask some questions to the patient. So they plan to postpone, they reschedule the test. Why? That is our question. First one, the client's hair is shampooed. It's a good thing to do before the EEG procedure. Second one, the client took a morning dose of an anticonvulsant. C, the client ate a full breakfast. D, the client drank orange juice instead of coffee for the breakfast. What is our answer? Our answer is B. An EEG is a graphic recording of electrical activity of the brain. EEG electrodes are placed on the scalp over multiple areas of brain to detect and record electrical impulses. Procedure of EEG include client teaching about the procedure, shampooing the client's hair is a good thing, and providing a full meal to prevent hypoglycemia. They can take food, breakfast, anything. It's okay, no problem, which could alter brain waves. Antidepressants, tranquilizer, and anticonvulsants are withheld for 24 to 48 hours before the procedure as are stimulants such as coffee, tea, cola, alcohol and cigarette. So what we have to explain to the patient before the procedure, they have to stop these kinds of medications such as antidepressants, tranquilizer and anticonvulsants should be withheld for 24 to 48 hours before the procedure, as well as avoid coffee, tea and some kinds of stimulating things, food. So our option is B. The client took the morning dose of anticonvulsant. Okay, then next question. A client admitted to the nursing unit from the hospital emergency department has a C4 spinal injury. In conducting the admission assessment, which of the following should the nurse perform first? First one, take the temperature. Second, assess the extremity muscle strength. Third, observe for dyskinesia. Fourth one, listen to breath sound. The patient with C4 cervical spine injury. In conducting the admission, which one is the first one? First one, what should be our answer? Our answer should be D. Listen the breath sound. Because the compromise of respiration is leading to cause of death in the spinal cord injury, cervical spinal injury, respiratory assessment is the highest priority. Assessment of temperature strength can be done after adequate oxygen is ensured. According to rule of ABG also, airway, breathing and circulation. So we have to give the priority to airway. Next question. A client with Parkinson's disease quickly develops akinesia while ambulating, increasing the risk of fall. Which suggestion should the nurse provide the client to alleviate this problem? What is the akinesia? A freezing movement. Otherwise, the patient cannot move, very slow movement. That is called akinesia. So, while ambulating, what should be the do? First one, stand erect and use a cane to ambulate. Second, keep the feet close together while ambulating and use a walker. Third option, consciously think about walking over imaginary line on the floor. Fourth one, use a wheelchair to move around. What should be our answer? Stand erect and use a cane to ambulate. First option, they cannot move with cane. Second option, keep the feet close together while ambulating and use a walker. Third option, consciously think about walking over the imaginary line on the floor. That should be our answer. C. We can go to the rationale. Clients with Parkinson's disease can develop bradykinesia or akinesia. Having these individuals imagine lines on the floor to step over can keep them moving forward. Although standing erect and using a cane can help prevent fall, these measures will not help a person with akinesia move forward. The client with Parkinson's disease should walk with a wide gait, not with feet close together. A wheelchair should be used only when the client can no longer ambulate with the assistive devices such as cane or walker. So our answer should be C. Imagine an imaginary line, walking over an imaginary line. Next question. A nurse is teaching measures to promote skin integrity to a client who is paralyzed due to spinal cord injury at the level of L4. The nurse determined that the client needs further instructions about these measures if the client states the patient has spinal cord injury at the level of L4. First option, make sure the button sheet is not wet and has no wrinkles. Second, use a pressure relief pad while sitting up in the wheelchair. Third, shift weight every 2 hours while in the wheelchair. Fourth, check skin for breakdown and redness with a mirror 3 times a day. Our question is, the client need further instruction about these measures. These also some kinds of negative questions, so the patient could not understand the techniques or procedures. So the nurse has to explain more. So first option, bottom sheet is not wet. It's a good thing to do. Use a pressure relief pad while sitting. It's also good. Shift weight every 2 hours. That's also a good thing. Avoid bed sore or any kind of injury. Fourth option, check the skin for breakdown and redness with mirror 3 times a week. It's not good. Check the skin for breakdown and redness with a mirror 3 times a week. It's not enough. We can go to our rationale. So our answer should be 4. The client should use a mirror to inspect the skin twice a day, morning and evening, to assess for redness, edema and breakdown. So how we have to assess in 2 times a day. In the morning and evening, the client has to assess any kinds of redness, any kinds of breakdown or something like that with the help of mirror. So our answer should be 4. Next question. A nurse has applied hypothermia blanket to a client with fever. The nurse should inspect the skin frequently to detect which of the following as a complication of hypothermia blanket use. First option, skin breakdown. Second, frostbite. Third, arterial insufficiency, venous insufficiency. What is our rationale? When a hypothermia blanket is used, the skin is inspected frequently for pressure points which cover time to lead skin breakdown. So our answer should be A, skin breakdown. When we use long time hypothermic blanket, there should be a chance to skin breakdown. Next one, GB syndrome has been asking many questions about the condition, and the nursing staff believes that the client is very discouraged about her condition. It is important for the nurse to include which of the following information in discussion with the client. Option 1, maximal paralysis occurs within 48 hours after diagnosis. Second one, paralysis occurs proximally to distally. Third, with maximal rehabilitation, function is regained with 3 months. Fourth one, generally a vast majority of people recover from this condition. Patient with GB syndrome, and the nursing staff believe the client is discouraged about some condition. It is important for the nurse to include which of the following information with the client. Our answer, vast majority of client with GB syndrome recover from paralysis because it affects peripheral nerves. Okay, the vast majority of patient with GB syndrome recovery because it affects only the peripheral nerves in the beginning only, that have the capacity to remyelinate. Maximal paralysis can take up to 4 weeks to develop. Paralysis progress distally to the proximally. Rehabilitation can take from 6 months to 2 years. So our answer should be fourth one. Generally, a vast majority of people recover from this condition. We can go to the other options also. Paralysis occurs within 48 hours of diagnosis. No. Paralysis occurs 4 to 4 weeks, up to 4 weeks. Then paralysis occurs proximally to distally. No. The paralysis occurs distal to proximal. With maximal rehabilitation regained with 3 months. No. The rehabilitation regained from 6 months to 2 years. So our answer is D. I hope you cleared these questions. Thank you for watching this video. Please subscribe and share to your friends also. Thank you. Bye.